Oh no, what is this? Have you ever been in a situation where you thought you may have a sexually transmitted infection? Or maybe in the past you have been treated for a sexually transmitted infection. Or maybe you could have one now. Or just maybe you want to learn more about sexually transmitted infections. Hi, my name is Diane Businda. I am a faculty instructor for the Cumberland Rudy School of Nursing, and I am going to talk to you today about sexually transmitted infections. So our objectives: describe the impact of sexually transmitted infections on the individual, society, and the healthcare system. Discuss the prevalence and incidence of sexually transmitted infections in the United States. Compare and contrast the signs, symptoms, and the management of sexually transmitted infections. And describe the prevention of sexually transmitted infections, including risk reduction measures. So it's befitting that April, specifically the week of April the 11th through the 17th, is Sexually Transmitted Infection Awareness Month. So we're going to look at many of the infections that you see on this screen. And what is a sexually transmitted infection? It is an infection that's spread through sexual contact from one person to another. And this could be through vaginal, oral, or anal intercourse. Some infections can be spread through very close skin-to-skin contact, also through sharing contaminated needles, and with breastfeeding. So human immunodeficiency virus can be spread through breastfeeding. And so in the United States, women who have HIV are not recommended to breastfeed. So let's look at a few statistics, and these are based in the United States. 1 in 5 people in the United States currently have a sexually transmitted infection, totaling 68 million infections in 2018. And 26 million of those were newly diagnosed sexually transmitted infections in 2018. And then half of all of these new infections occurred in people aged 15 to 24 years. This cost about $16 billion in medical care costs, and that's direct medical care cost. That is a lot of dough. So we're going to look at some common sexually transmitted infections in this talk. We're going to look at chlamydia, gonorrhea, hepatitis B, herpes simplex virus, number 2, human immunodeficiency virus, and human papilloma virus, syphilis, and trichomoniasis. Chlamydia, trichomoniasis, genital herpes, and HPV account for 98% of all prevalent sexually transmitted infections, and 93% of these new infections occurred in 2018. All right, let's look at a few more statistics. In this slide, you'll see that it talks about the prevalence and the incidence of sexually transmitted infections. And so the prevalence means the number of cases of any disease or infection. In this case, we're talking about sexually transmitted infections. So the number of cases that are present in the population at any given time. And then your incidence, this is more of an estimated number of new cases of sexually transmitted infections within a given time frame. And this estimation could be both diagnosed and undiagnosed infections. So HPV is your human papilloma virus, and you can see it has the greatest prevalence and the greatest incidence, followed by your herpes simplex virus. And the interesting thing about both of these are viruses. So our body kind of hangs on to these. If we have a bacterial infection like gonorrhea and syphilis and chlamydia, we can take some antibiotics and help get rid of those. So I think that's a contributing factor in the prevalence and the incidence of these. So again, we spend $16 billion. 26% of that is in the population of 15 to 24 years of age. Women count for 25% of this. And then I find it interesting that we spend $1.1 billion just on 3 infections, chlamydia, gonorrhea, and syphilis. And all of these are those bacterial infections that we could easily get rid of by just going to our healthcare provider, getting some antibiotics and taking those antibiotics until the treatment is completed. Here you have another graph that reviews the healthcare cost of our sexually transmitted infections. And HIV, human immunodeficiency virus, cost $13.7 billion in 2018 for healthcare costs. Follow that by your HPV, your chlamydia, your gonorrhea. So remember, some of these can be easily treated. So we should be able to eradicate, not maybe eradicate, but really decrease the incidence of these diseases. So what are some risk factors? Number one, probably risk factor is having unprotected sex. And that could be vaginal or anal intercourse or oral sex. So you're having intercourse or sex without using a latex condom. It has to be a latex condom, or many times condoms are not used appropriately or in the right way. And that also can lead to transfer of disease. Oral sex is less risky as far as transmission is concerned, but you do transmit infection through oral sex. Multiple partners, the greater number of partners that an individual has, the greater risk involved in that. And that can mean the greater number of partners at one time, or it could mean the greater number of partners through an individual's lifespan. Men having sex with men definitely increases the risk of sexually transmitted infections. Any history of sexually transmitted infection increases the susceptibility of acquiring the same infection again. Half of all infections occur in that certain age group of 15 to 24 years. And then the younger a person is when they become sexually active, then the more exposure, which increases their risk of getting a sexually transmitted disease. And then misuse of alcohol or recreational drugs. When we are involved in drug abuse or alcohol abuse, this can impair our judgment and, many times lead to kind of some unhealthy choices or maybe some unsafe choices. It can also place a person at risk of being in an unsafe situation that may lead to a type of abuse that can lead to sexually transmitted infection. Sharing needles, like our IV drug abuse, sharing needles that are contaminated will spread infection, especially hepatitis B and HIV. Sharing needles also transfers hepatitis C. However, hepatitis C is not considered a sexually transmitted infection. And then perinatal, during pregnancy or via childbirth, a woman who's infected with gonorrhea, chlamydia, HIV, and syphilis can pass that infection on to her unborn child. And so we can treat the woman in pregnancy. We can treat the baby with some iron ointment to help prevent infection to the baby. And then with a mother with HIV, we will treat her with IV meds during the labor process to help decrease transmission to the baby. So we're going to look at different types of infection. We have the bacterial infections and we have the viral infections. Bacterial are chlamydia, gonorrhea, syphilis, and trichomoniasis. Now, trichomoniasis is caused by a protozoan, not a bacteria. However, we can treat that with antibiotics. So I included that under bacterial infections. Your viral infections will be hepatitis B, herpes simplex 2, human papillomavirus, and human immunodeficiency virus. So let's look at chlamydia. So chlamydia trachomatis, we just call it chlamydia in the healthcare world. This is more common in sexually active women, ages 14 to 24 years. It's caused by the bacteria chlamydia trachomatis. It's spread through vaginal, oral, and anal sex, and it can be spread from the pregnant woman to the baby during delivery. And we do treat the baby with IV eye ointment to prevent infection in the eye. The baby could get a respiratory infection such as pneumonia as a result of the chlamydia infection. It's very difficult to diagnose initially because many times the person may not have symptoms or the symptoms are very kind of vague or non-specific. So they might be easy to ignore. So symptoms can include just some difficulty urinating, vaginal discharge in women, painful intercourse, bleeding after intercourse, or mid-cycle bleeding. And that means bleeding in between the menstrual cycle. Men can have discharge from the penis or testicular pain. Now, with advanced stages of chlamydia, this might bring a patient to the ED or to call our healthcare provider, because now we have increasing pain, especially with women. They'll have increasing pain in their abdominal area and all in the pelvic region. The vaginal discharge increases, they run a fever, and they just become really sick. And this infection that they get is called pelvic inflammatory disease, or PID. And this infection starts kind of, it's ascending. So it starts in the vaginal cervical area and it moves up into the uterus and into the fallopian tubes and into the ovaries. And that's where all that diffuse pain comes from. This infection in women can lead to problems getting pregnant, may not be able to get pregnant, so infertility, and it definitely increases the risk of an ectopic pregnancy, which is a pregnancy in the fallopian tube instead of the uterus. Your next infection is gonorrhea. Gonorrhea, again, is caused by the bacteria Neisseria gonorrhea. It's also spread through vaginal, oral, and anal intercourse. It also can be spread from the pregnant woman to her baby during delivery, causing a serious eye infection and even blindness if it's not treated. So we put the antibiotic ointment in the baby's eyes. Again, always your highest incidence is in that certain age group, 15 to 24 years of age. Females tend to have a little higher rate than males. Symptoms in men are painful urination, pus-like discharge from the penis, or pain and swelling in the testicle. Women can have increased vaginal discharge, painful urination, and vaginal bleeding, or bleeding after intercourse, and again, mid-cycle bleeding or bleeding in between the menstrual cycle. And you can see here in the slide the discharge from the head of the penis and the milky discharge on the inner side of the labia. Your next infection is syphilis. I'd say syphilis and gonorrhea are probably two of the more the oldest sexually transmitted infections there is. Your syphilis is caused by Treponema pallidum. It's again spread from person to person contact via skin or mucous membranes that has a sore on it. We call it a canker sore. And if you look in your pictures here, you'll see this canker sore right here on the side of the penis. You'll see it right here around the labia and around the, anal area or the perineum on the woman. You can see it on the mouth and on the tongue. The presentation of syphilis comes in stages. So your primary stage is when the person has this painless sore. So the only symptom they'll have is a sore they develop, and many times they may just ignore that. And then that painless sore occurs about 5 to 90 days after exposure. Then person goes into the secondary stage, and this is when they become more symptomatic. So they start showing flu-like symptoms, body aches, fever, just a lot of fatigue. They develop a rash on their hands or feet, and it can be over their body. And you'll see it's kind of a red papular rash, and that's kind of a classic sign. And then it can develop on into what we call the latent stage. A person may not have any symptoms and it can last for years, or they will progress to the next stage, which we call tertiary. And in this stage, the infection spreads through the internal organs and people can die during this phase. It can be spread during pregnancy and delivery. What the interesting thing about syphilis is we can cure this with one injection of penicillin. So it is so easy to recognize the symptoms and go get treated. But if we don't treat it, then the individual will move through these stages that I just talked about. And then your trichomoniasis, and that is caused by a protozoan, Trichomoniasis vaginalis. It passes from people during intercourse. Symptoms typically will appear about 4 to 28 days after exposure. And symptoms in women are foul-smelling vaginal discharge, redness, burning, itching on the genitalia, pain with urination, or pain with intercourse. The discharge is very classic it's kind of frothy and there's large amounts, so it's very copious. And the discharge could be greenish in color, yellowish in color, grayish or whitish in color. But the odor and the discharge itself seems to be very classic. Symptoms in men are irritation around the penis, discharge from the penis, burning with urination, and burning with ejaculation. So treatment, we've kind of talked about treatment as we went along talking about these bacterial infections, but 3 important factors to remember is screening. If a person is sexually active, they should have yearly screening to rule out any sexually transmitted infections. And if they do become symptomatic with any signs of infection, they should call their healthcare provider or go to the health department to be examined and to get a prompt diagnosis so they can be treated with antibiotics. The antibiotics need to be taken as prescribed. Don't stop taking them when you feel better or when the symptoms disappear, because the infection can remain. So it's always important to complete the round of antibiotics. And sometimes the provider may have you come back for a follow-up just to test again to make sure that the infection is completely gone. So if you don't have a primary physician or midwife, you can go to the health department, you can go to the school health services, you can go to Planned Parenthood. So there are a lot of avenues where you can go and seek treatment. And it's very important that we treat any of our partners that we've had sex with, because that can continue the spread. So you need to notify any partners that you may have been involved with, and let them know that you're being treated for an infection, and they also need to go and get treated so we can combat the spread of the infection. All right, let's look at now, and we're going to switch gears, and we're going to look at some viral sexually transmitted infections. These are called by viruses that cannot be cured, so they kind of remain in our body for life. Sometimes the symptoms of the virus may kind of go dormant, and we may not have those symptoms, but any various things can trigger an outbreak, such as illness or stress. So whether any infection is viral or bacterial, the infection can have long-term effects on the body. So as I talked about earlier with the chlamydia, it can cause infertility in women. Infections can also cause sterility in men, and it just leaves the body more vulnerable to other serious diseases, such as HIV. So without treatment, any of these infections, whether viral or bacterial, can continue to spread to the body organs and cause increasing problems. So with our viral sexually transmitted infections, we're going to talk about hepatitis B, herpes simplex 2, human papilloma virus, and then human immunodeficiency virus. So hepatitis B, you can get by having unprotected sex with someone who has the infection. It can pass from a person's blood, saliva, semen, or vaginal secretions that enter your body. It can also be spread through IV drug use with needles or syringes that are contaminated with blood. It can be passed from healthcare workers who may have an accidental needle stick from a patient that has hepatitis B. It can be passed perinatal through pregnancy and delivery. And one of the risk factors is certain areas of the country will have a higher incidence of hepatitis B. So your risk is going to be greater by traveling to areas such as Asia, Africa, Eastern Europe, and the Pacific Islands. So mode of transmission and risk factors for hepatitis B. This person, part of the treatment or prevention would be getting hepatitis B vaccine. And there's a series of those that have to be taken. So by getting the vaccine, you're really going to minimize your risk of getting hepatitis B. Human papilloma virus, we also call this genital warts. It's the most common sexually transmitted infection in the US. There are more than 40 types of HPV that just affect the genitalia area. There are over probably 100 or more types of HPV viruses, but there are specific viruses that just kind of target the genitalia area. It's transmitted through vaginal, anal, and oral intercourse. And it also can be transferred through that genital skin-to-skin contact with another person who has the infection. The HPV could be found anywhere around the penis, the scrotum, the rectum, the vulva, which is the outside part of the vagina, the labia, the lining of the vagina, the cervix. So sometimes we might be able to feel or see one of these little bumps, and sometimes they're internally where only a healthcare provider can see them through an exam. So symptoms, typically a patient may call their doctor's office or clinic and say, I have some bumps, or I have a bump that I don't know what it is. And so that kind of brings them in. But genital warts can be described as being kind of flat or almost kind of mounded, rounded. They're pink in color or fleshy, kind of skin colored. You can have a single bump, or they can occur in groups, or we call them clusters. When they occur in clusters, it almost looks like cauliflower type looking. And like I said, they can be difficult to see. So sometimes there's no symptoms initially, but then as they spread, um, a person may have kind of itchy, around HPV. They may have bleeding. You can get HPV in your mouth from having oral sex. And HPV can cause some types of cancer, like cervical cancer, vaginal cancer, in women, penile cancer, in men, cancer around the anus or rectum, cancer in your mouth, such as on your tongue or in your throat. Risk factors are just like all the other risk factors: unprotected sex, having multiple partners, recreational drug or alcohol abuse. Treatment, they never go away. We can try to surgically remove them, or we can try to freeze off the little bumps. However, they never go away, and they do come back. But they may help kind of with some of the symptoms by trying to remove them. But remember, they will come back because it's a virus. There is a prevention, and that's called the HPV vaccine. And they usually recommend getting the HPV vaccine, both male and female, and getting the vaccine prior to any sexual intercourse. So young years. So usually they'll recommend like around 11 and 12, start getting the HPV vaccine. And that is, again, a series of 2 to 3 vaccines, depending on what age it's started by the individual. So it's recommended to start younger and complete the series to have full protection. We can do what we call kind of catch-up vaccines for males and females, and they would get 3 doses versus 2 doses of the vaccine. Definitely recommend it for men who have sex with men and people who may have a compromised immune system, as far as that's concerned. So we can't get rid of it. We can try to prevent it by getting the vaccine, and it can lead to cervical cancer and other cancers in male and females. Your next virus is your herpes simplex virus. We call this genital herpes. It's acquired through sexual contact, again, in the vaginal, anal, or oral sex is the primary way the virus spreads. It also can be spread by the individual touching these little blisters that you see on the screen, by touching these blisters and then touching another, part of somebody else's body. These blisters will actually burst open, and then if you look over here to the right, they will get all scabby looking. So initially, most people may not even know they're infected with the herpes simplex virus, because initially they may not have symptoms or they're very mild. I've seen people who develop the virus, and with their initial outbreak, they get very, very sick. So they have flu-like symptoms, swollen lymph nodes in their groin area, just muscle ache, fever, and headache. They just feel very, very sick. So the initial outbreak can be very difficult for the individual for the very first time. And then subsequent outbreaks can be milder. And a lot of times a person may have a prodromal sign that they might be having an outbreak, such as they may start to have a tingling sensation around their genitalia area, or maybe a light kind of stinging, burning sensation. And that's a pre-sign of an outbreak going to occur. Exposure or signs and symptoms can occur about 2 to 12 days after exposure. And the symptoms, signs and symptoms can reoccur on and off. So this virus will go dormant, and then an individual can have just outbreaks at various times, especially during illness or signs of stress. We usually recommend no intercourse during a prodromal sign or during the signs of an outbreak. We can treat these with antiviral medications by mouth and putting some cream on the blisters, just offering comfort measures such as warm soak in the tub, using a hair dryer on the lesions to kind of keep them dry, wearing cotton underwear, things like that. So comfort measures, taking your ibuprofen for the muscle aches and pains. So you want to take the antivirals when you have symptoms of an outbreak, and you need to take the medicine daily during this time you're having an outbreak. So flu-like symptoms, pain, body aches, headache, fever, the blisters that eventually they ulcerate and they scab over. And your HIV, or your human immunodeficiency virus, is a virus that damages your immune system. So HIV interferes with your own body's ability to fight infection and disease. There's no cure, but it can be treated with medication. And the goal of treatment would be to keep the infection at bay and prevent going into full-blown AIDS. HIV is spread just like other infections through bodily fluids of a person with HIV, transferring it to someone else through unprotected sex. Also spread through sharing needles. HIV, we've already talked about how it can be spread through birth and breastfeeding. HIV develops in stages, so you'll have the primary or acute stage that develops about 2 to 4 weeks after exposure to the virus. And this is when the person will have fever, headache, kind of those flu-like symptoms, muscle aches and joint pain. They can develop a rash, sore throat, and painful like mouth sores or ulcerations inside their mouth, swollen lymph glands, diarrhea, weight loss, cough, and night sweats. So that's your kind of your acute outbreak. And then there's the chronic outbreak that occurs after this, when the HIV is still present in the body and in the white blood cells, but the symptoms are now kind of subsided, or, you know, there's no evidence of infection during this time. This stage can last for years and years. And we definitely want to use the antiretroviral therapy to help combat the HIV and prevent the going into full-blown AIDS. Some people will keep at this stage for a long, long time, and some people will progress back to the symptomatic stage. And this is where the virus is just continuing to multiply, and it really destroys the individual's immune system. So now they have no ability to fight off infection, and even mild infections are very harmful to the individual. So they'll have chronic signs and symptoms of those flu-like symptoms, and all the other symptoms like diarrhea, weight loss that we talked about. So treatment, definitely with your antiretroviral therapy, we call that ART. And ART is really a combination of various medications, typically about 3 medicines that they put into one pill, and the individual takes it daily. And for our pregnant women, because I work in the women's health in the newborn field, pregnant women will get IV antiretroviral therapy during labor and birth to help protect transmission to the fetus and the baby. So treatment, again, we've talked about treatment as we went along, but remember your viral sexually transmitted infections cannot be cured. We can just treat the symptoms. So screening, again, if you're sexually active, you should have a yearly screening. If you develop any signs and symptoms, seek the care of a healthcare practitioner, get diagnosed and get treated with your antivirals or your antiretrovirals. Remember your HPV, we can try to surgically remove those or use a freezing method, but they can return. Comfort measures would be just a multitude of things like cool cloths to the area or a warm soak in the tub, using the hair dryer, stress therapy. Try to combat your stress as much as possible because stress can increase the risk of an outbreak. Sometimes we'll use like a steroid cream on some of the HPV outbreaks just for the signs of itching. So our treatment goals are just to reduce the symptoms and provide comfort measures for the patient. We cannot get rid of the virus. It's always going to be in our body. So prevention, we have primary and secondary prevention. Your primary prevention is aimed at preventing infection, and the number one way of doing this is abstinence. So that involves refraining from all sexual activity, vaginal, oral, and anal sex, because all of these involve transmission of semen, body fluids, through the active intercourse. We'll aim a little more with our secondary prevention because this is aimed at just reducing our risk of getting a sexually transmitted infection when a person is sexually active. So number one would be using a latex condom. And a latex condom, condoms are made for both men and women. So you will, a woman's condom is made to fit right into the vaginal wall or vaginal canal to help protect her from the bodily fluids that may be infected. The men condom goes over the tip of the whole penis. And it's important that we know how to properly put on a condom and how to properly remove the condom. And the condom needs to be put on right before any sexual act when the penis is erect, because there is always that kind of ejaculate that can carry infection. There's also something called dental dams, and dental dams are just latex sheets of material, and you can use these and put over the mouth or around the rectal area or the anal area. Again, and that protects transmission during oral intercourse or anal intercourse. Monogamy means having sexual intercourse with just one person, having one relationship, or limiting your sexual partners. Remember, the greater number of sexual partners you have over your lifespan, or the number of sexual partners an individual may have at one time, definitely increases the risk. Examining a partner for lesions. So I always kind of, when I talk about this in my class, I always kind of laugh and say, yep, right before you're getting heavy into your relationship of intercourse, you need to say, hold on, let me take a peek and make sure you don't have any lesions. So I'll make a joke about it, but it is important to try to examine your partner to make sure they don't have any lesions, because not everybody is honest and owns up to the fact that they may have symptoms of a sexually transmitted infection. We've talked about recreational drug use and alcohol use, how that can increase and impair judgment and it can lead to unhealthy kind of decision-making and also put the individual in compromising situations that may lead to them acquiring a sexually transmitted infection. Screening, that yearly screening is so important, and getting tested when we have signs and symptoms. And we really need to focus our education on that age group, you know, the teenagers through the 20s, because they have the highest risk factors. And then vaccinations, hepatitis B and HPV, those are vaccinations that you can take as an individual to help protect your risk of acquiring those viral infections. And then our antiretrovirals for your HIV spread to full-blown AIDS. So your secondary prevention is probably going to be the key to just lowering the whole burden of an individual acquiring a sexually transmitted infection. It's going to help our society and definitely help the healthcare system overall. So secondary are going to be our biggest prevention measure that an individual can take. And in summary, the sexually transmitted infection burden in the U.S. cost roughly $16 billion in 2018. $1.1 million were related to the bacterial infections like chlamydia, gonorrhea, and syphilis that can easily be cured with antibiotics. 1 out of 5 people in the United States have a sexually transmitted infection, and the age group of 15 and 24 tends to be your higher risk age group that account for half of the sexually transmitted infections in 2018. Treatment varies based on diagnosis. We've talked about our viral infections. We treat the symptoms, but the infection remains in our body, and the bacterial infections we can treat with antibiotics. Prevention is the key. Primary is being abstinent, and your secondary involved condom use, reducing our number of partners, reducing our risky behavior. So my philosophy always, when in doubt, check it out. Don't be afraid, don't be embarrassed or whatever to, you know, call your physician or go to the school clinic or go to the health department and just say, hey, I have this I'm a little concerned about. I just want to make sure that it's nothing serious, or if it is, let's get treated and take care of this. And then remember always to notify any partners if you know who they are. Always, it's important to notify any sexual partners so they can be treated as well. So this is my talk on sexually transmitted infections. I hope it provided some learning for you, and I appreciate you watching. Thanks a lot and have a great day.